Good afternoon and welcome everyone to this webinar. I'm absolutely delighted at the take-up on today's topic. I wish it weren't necessary, but I know that it is. My name is Catherine Carlton. I'm Executive Director of Orchestras Canada, Orchestra Canada, and I speak to you today from Peterborough, Ontario, long known as Nogojiwanong, the place at the end of the rapids. On behalf of Orchestras Canada and the team here, I respectfully acknowledge that we are on the treaty and traditional territory of the Mississauga Anishinaabe and on land that is covered by Treaty 20, the Williams Treaty. I offer our gratitude to the First Peoples for their care for and teachings about our earth and our relations. May we honor those teachings. This is the first in a series of webinars that we're going to be doing with the generous support of the Ontario Trillium Foundation as part of our Resilient Ontario Orchestras initiative. Through Trillium's generosity and the willing participation of a group of skilled consultants and orchestras from across Ontario, we've been able to match up orchestras who had an issue that they wanted to work on with consultants who had the skills to help them out. And although the main part of our programming will be taking place in November of this year, we accelerated access to some of the learnings and early outcomes from the consultancies by inviting one of Canada's experts in the area of safe working conditions in the performing arts to join us, along with representatives from two of the orchestras that she had the opportunity to work with. The preoccupation, of course, is safe reopening for orchestras, safe procedures that will help ensure that rehearsals and concerts are as safe as they can be. And we knew that this is a burning topic for so many of you exactly right now. We're focusing on the regulations that are in effect in Ontario right now, but drawing on research and expertise from around the world. And I can't say enough about how excited I am to bring not only Janet, but also folks who have real-world experience of working with no resources whatsoever other than hard work, ingenuity, and strong relations in the community to keep the music going. And those are representatives from the Northumberland Orchestra and Chorus, as well as the Kitchener-Waterloo Community Orchestra. And we wanted to ensure that Janet's insights were linked with the real world experience of people in the smaller budget orchestra zone here in Ontario. And we're just so honored that they agreed with such alacrity to join us today. So I think that's my introduction complete, with another underlining of our gratitude to the Ontario Trillium Foundation and our wonderful speakers today. I now pass the microphone over to my colleague, Lauren Drew.
Good morning, everyone. My name is Lauren Drew. I'm Director of Member Services and Learning for OC. I'm also grateful to be joining from the Treaty and Traditional Territory of the Mississauga Anishinaabe in Peterborough, Nogojiwanong, Ontario. So just a couple of tech notes before we get started. Please keep your audio and your video muted. We are recording the session to post on our YouTube channel, but if your video and audio are muted, you won't be appearing in the recording. There will be a Q&A portion in the last 15 minutes or so of the session. So be sure to type your questions for our speakers in the chat. I'll be monitoring them and we'll get them asked near the end. We do have closed captioning services through our Zoom today, and that's offered by rev.com. To enable those, scroll to the bottom of your screen and there will be an option for closed captioning. It'll be an icon with CC on it, and I'll paste more detailed instructions in the chat afterward. And following the session, we'll be circulating links to the PowerPoint, the template documents, and a few other resources via email, and we'll also be posting the recording. So with that, I will hand it over to Janet to get us started.
Janet, I think you're muted. We have to have a webinar with at least one person who's not on.
And I may as well start off the mute unmute situation right off the top. Is my slide showing okay?
Yep, you're good to go.
I'm good to go, and go I shall. So I'm Janet, and my pronouns are she and her, and I'm joining you from Stratford, Ontario, the traditional territory of the Anishinaabe, Haudenosaunee, and the Ojibwe Chippewa peoples. This territory is covered by the Upper Canada Treaties, and we thank all the generations of people who have taken care of this land. So some of you may have met me in the past. I've been doing a few webinars over the past year and a half, and hello to anyone who I may have crossed paths with before. I'm happy to be here to give an update to let you know where we're at today. I have a quick disclaimer. First of all, I'm not a doctor, lawyer, or a public health expert, and our understanding of COVID-19 is changing rapidly. So this conversation is for information only, and you must comply with all local, regional, provincial, and federal requirements and apply them to your specific circumstances. And just to be clear right off the top, I'm not saying that you can or can't rehearse or perform. Each organization must make their own choice, but I'm hoping that this webinar is going to give you some more things to think about as you narrow in on that choice. And finally, I need to be honest and say I am not a musician. I wish I was. However, music has a very important place in the life of our family. All right. So we've talked a lot over the past year and a half about our priorities for reopening. First and foremost, we want to keep our musicians, workers, and guests healthy and safe, create environments where patrons feel confident to return, and implement effective health and safety protocols, because we know they're going to be the most important factor in successful reopening. So we can't expect our patrons to return with confidence until we've taken precautions to protect our people. Now, where are we at? So this is 553 days into the pandemic. Back in May, we had the third wave with its high rates of hospitalizations it subsided, and the vaccination rates at that point began to slow down. June 16 was when we entered step 3 of the roadmap to reopening. And that was the point where our 7-day case average hit its lowest level, but unfortunately it began to rise again. And we now find ourselves in the 4th wave. So there were some very concerning reports that I'm sure all of you have seen. This is likely to be the 4th wave, will be the pandemic of the unvaccinated. There is a high likelihood that people who continue to be unvaccinated will become infected. And this is tremendously concerning. Okay, I'm just going to show you this quick image, which shows a comparison between 2020, which is the gray line, and 2021. So we can see how we had a high number of cases in the spring, dropping through the summer, and we are now back on that upward trajectory, unfortunately, for this fall. So back in June, July, I was certainly a great deal more hopeful about where we would find ourselves in September. But as always, we have to work within the conditions we find ourselves in. All right. So step 3, which is where we remain now, we have indoor venues are open, including live music, but we have capacity and other restrictions. Outdoors is open, still with some capacity restrictions. We were anticipating moving into the exit step in August, but that has been placed on pause. The idea was that when we reach the exit step, capacity limits, physical distancing, and other step 3 requirements would be lifted. However, the indoor mask and face covering requirement will continue. I don't know what's going to happen, whether we will eventually get to the exit step or whether they will come up with an entirely different framework. That remains to be seen. Additional things to consider are the fact that your local health unit can enact more stringent requirements. Your venues as well can enact more stringent requirements. And one of the most important things for you to consider as you look towards your fall activities are the comfort level of your orchestra and choir members and volunteers. All right. What about vaccines? So vaccination is not the focus for today, but we have recently learned that Ontario will require people to be fully vaccinated and provide proof of their status to access certain businesses and settings, and that starts in a week. The regulatory amendment and the guidance was just released yesterday. Orchestras Canada has put together a terrific summary, and I know that they are sending that out to their members. This vaccination initiative will focus on indoor, higher risk public settings where face coverings cannot always be worn. And this includes patrons at concerts, music festivals, theaters, and cinemas. Just to be clear, this legislation is exclusively about patrons. Now, you may choose on behalf of your organization to implement a vaccine policy, but vaccine policies that are related to musicians, workers, contractors, and volunteers are at the discretion of your organization, your venue, or both. So you may be rehearsing in a post-secondary school facility or church or even a secondary school. Whatever that venue is, they may have put together a vaccine policy, which you will be obligated to comply with, and or you may choose to implement a vaccine policy specifically for your organization. When you look at the, trying to make decisions about whether you want to make that type of a policy for your organization, the things you need to consider are the risk of COVID-19 transmission. So some parts of the province are much more vulnerable than others, just in the way that the fourth wave is taking off. And you need to consider things like human rights and accessibility, labor and employment law, privacy, healthcare consent, and occupational health and safety. So as I said, Orchestras Canada has some terrific resources that they will be providing for you to consider. So before we, I'm going to be taking you through the templates that we developed in working with the two orchestras. But before I look at that, I want to take a little bit of time and talk about risk assessment. Risk assessment is a really valuable tool for the arts, entertainment, and live events because it allows us to focus on the unique challenges facing our community. There are lots and lots of different risk assessment templates, and I encourage you to seek out one that suits you and scale it to your organization. Now, the purpose of a risk assessment is to identify potential hazards, assess the level of risks, and then develop the controls or precautions specific to COVID-19. As you're going through that process, consider the life cycle of your rehearsal or performance. So think of it all the way from when you load in and set up right through to when you strike and load out. And consider the journey of all the different people who will be involved, your orchestra members, your workers, your volunteers, and your patrons. And I just want to make a note that when you are working with volunteers and thinking about health and safety, it's really important that we provide them with the same protection as workers under the Occupational Health and Safety Act. So if there is a hazard, we need to protect workers and volunteers equally. So what are some of the considerations that you should be thinking about? First, I suggest you think about your activities. So what activities are you planning? Are you planning to do private, small group, or large group sessions? Are you going to focus on rehearsal, maybe without even considering public performances at this point? Or do you have a goal that involves performances either this fall or early in 2022? Where are you planning to gather and play? Indoors, outdoors? Is it a small or a large venue? What sort of ventilation will you have available? In some venues, there is excellent ventilation. A lot of venues have been doing a lot of work to improve that, but you will encounter places that have very minimal ventilation, and that will make a difference to what you decide you're going to do. And look to your venues because they may have their own requirements. So when you think about what you're planning to do, where you're planning to do it, the next thing is think about how long are you going to gather and play? Are you planning to do very short rehearsals, maybe longer rehearsals, shortened performances? All of that will play into your decisions. The next thing after you've looked at your activities is people. Who is going to be involved? Does your orchestra involve any children under the age of 12? Because these kids can't be vaccinated. Are you primarily working with healthy adults, either vaccinated or unvaccinated? Do you have people in your group to consider who may be vulnerable due to medical conditions or who live with someone who is vulnerable? And also think, if you're planning performances, who will be attending? Again, is it kids? Is it healthy adults? May there be some people who are vulnerable? And then we can look, so risk assessment, it looks at hazards, but then it also looks at the likelihood and severity. If, how likely is it that someone's going to become ill? How severe could that illness potentially be? So when we look at the probability that something is going to cause an illness, we know that for COVID-19, transmission is higher with prolonged exposure. So when we're spending more time together, when we're in close proximity, working closely with others, when we're in crowded places, having more people in the space, when we're in closed spaces with less fresh air, obviously working indoors is riskier than working outdoors. And if we're involved in activities that have forceful exhalation, so things that make people breathe more deeply. Could be exercise, speaking loudly, singing, playing wind and brass instruments. All of those are the factors that will influence the likelihood of an illness. And also consider your local public health case data. So the infections have varied throughout the province. You may find that you're in an area of the province that has had very high incidence of cases and deaths, or you might find yourself in a pocket of the province that has been less affected, and that will make a difference. When we look to severity, how serious could that illness be? To a certain degree, we have to assume that anyone could be potentially unvaccinated and infected. The risk of infection, severe disease, and death is much higher for people who are unvaccinated. And at present, we have that whole cohort of children who cannot yet receive the vaccine. And the final part of risk assessment is choosing our controls, selecting precautions that will protect people from infection. Many of you will have seen this illustration before. It shows the benefits of choosing multiple layers of protection to protect against transmission. And if we think of each sort of precaution we take as being a slice of Swiss cheese, each one has some holes. None of them is 100% perfect, but we hope by layering those different precautions that we are going to really be able to protect people very, very well. And this is the newer version of this image, which has the vaccines at the very front. And you can see it's a shared responsibility. There are certain things that the organization will do and the venue possibly, but there are also personal responsibilities that are on each of us to carry through. When it comes to planning, I'm going to just go through this little tips for success that I've pulled together, and then very shortly we'll go on to look at the templates. Keep in mind that just because you can rehearse or perform with minimal precautions, it doesn't mean you should. So right now we have some ambiguity in the regulations where there are a lot of openings where you could do very little, but your spidey senses will probably be telling you you need to do more. Your plan needs to be as unique as your organization. So you may find that different orchestras are doing different things, and that's okay, provided there is a thorough consideration for what the circumstances are. You might find it valuable to consider surveying, ideally anonymously, your people, and for young people, their families, to understand their comfort levels and preferences. And you can anticipate that there is going to be a wide range of concerns, feelings, and individual vulnerability. Through all of that, we need to be really conscious about keeping our conversations respectful, especially if there is disagreement. Choose activities that your organization can reasonably accomplish safely. Plan for those multiple layers of control and lean more towards cautious choices. Watch for new requirements and be ready to adapt. And always remember that creativity and problem solving are your superpowers. And they're going to be much in demand for the rest of this year, certainly. So the next thing I'm going to focus on, and I will jump you into the templates momentarily, but all businesses that are operating must have a COVID workplace safety plan. And there are 7 elements that are required. The first one is communicating. Next is screening. Then we move on to preventing transmission. And you have to identify what you're going to do if there is a potential case or suspected exposure. You have to show how you will manage any new risks caused by changes and how you're going to make sure your plan is working. The final piece is a safety plan snapshot. So it's just a 1 or perhaps 2-page summary of this information. So next I'm going to move on to show you 2 documents. I separated them because when you're submitting information to a venue, you probably only need to submit the workplace safety plan, but I wanted to provide some additional background and planning information. So that's what the first document is about. And there is some duplication between these two documents. So I am just going to jump out of my screen share with this. And I'm going to extend that. Thanks for your forbearance as I mutter. And I'm going to move now to screen share. This one. All right. So hopefully everyone can see this document, which is, oh no, did I do the right one? Holy moly. There we go. Okay, so I'm hoping everyone can see COVID-19 safety background and planning. Yes, thank you for the thumbs up, Catherine. We're going to move along. Okay, so this template, it's a Word doc and it is set up so that you could save it and adapt it to your own needs. I've highlighted things that you would need to customize. You could do a quick find and replace to put the name of your organization in. Always important to have your date because you will probably do several different versions of it. And I've got on the front a disclaimer just to let you know when this template was created and what it was based on. So this is based on the July 16th, Step 3 regulation. Okay, so we start off with the purpose, just describing that this document is about background information and planning guidance and what the purpose of the plan is. We then have a scope section, which identifies the activities, locations, and people. Again, all of this you would customize to match the descriptions that you use for your people. And it also, just a disclaimer, it doesn't cover your non-COVID hazards, but you will obviously be dealing with those at the same time. We have a list of references. The first one, I suggest you add your local public health website. Then we have the regulation, the current regulation for Step 3 and the roadmap exit step, followed by the COVID-19 health, safety, and operational guidance for schools. And that's a good reference just because you can see how the school system is addressing things, and that's kind of handy. The way I set this up is all of the links are hyperlinks, but with the actual link following in case you happen to be working from a printed version and you want to be able to seek out the link. We've got the Government Ontario website, Public Health Ontario, Public Health Agency of Canada, and World Health Organization. So those are all your general sort of COVID references. Then we go into some live performance and music guidance, beginning with singing and playing wind instruments. This is an environmental scan from August from Public Health Ontario, followed by the live performance health and safety during COVID guideline from the Live Performance Health and Safety Advisory Committee of the Ontario Ministry of Labour, Training and Skills Development. And that's an advisory committee that I have been part of for, I think, about 18 years, a long time. And you are well represented in the music world by Steve Mosher, who has been on that advisory committee much longer than I have. So he certainly speaks up with respect to the needs and issues relating to orchestras and music. There's also a link to the Safe Singing and Playing in Ontario Music Programs document from Ontario Music Educators Association, and the update guidelines for fall 2021 activities from the National Federation of State High School Associations in the US. So those are some links that you probably are already looking at, but just gathered in one place. Then we go into a section about responsibilities, and this is describing responsibilities under the Occupational Health and Safety Act. Now, I know it probably seems a little strange to be thinking about the Act with respect to organizations that may be volunteer-led, but if your organization is paying anyone, even if it's just one person, it might be your musical director, then you have an obligation to comply with the Occupational Health and Safety Act. So I've highlighted the likely person who would be involved, who would fall under that role. So typically we're looking at the board of directors as filling the role of the employer for community orchestras. Supervisors would include board of directors and possibly pandemic safety monitor or someone who you have assigned who is filling a role of that type. And then there's an obligation to do much more in the terms of implementation and enforcement if you are a supervisor. And then workers and volunteers include musicians, singers, independent contractors, and so on. And I encourage you all to adopt a policy where you are going to apply the worker requirements to your volunteers as well, because they deserve equal protection. This then moves on to some information about capacity, and this is from step 3. So I'm not going to dwell a whole lot on this because I know you're familiar with it, but the sections that are relevant I've identified here. There's some that relate to all businesses and facilities open to the public, some restaurants and bars. So if you happen to do performances in those settings, that would apply. Food and drink establishments with dance facilities. And then most commonly, you're going to be looking to the concert venues, cinemas, and theaters. And then there is a description here about how the capacity requirements apply. And I'm realizing that I only have the outdoor in that. I'm going to do an update to that and I will send it to Lauren. There we go. Okay. Now I've also made a note here about the requirements for capacity under the exit step. We are not there and we don't know when we're getting there, but at that point there will be no capacity restrictions. Now I've also, section 6 is a risks summary. We've just reviewed most of that, how COVID is transmitted. 6.2 looks at different places where transmission may occur in live performance. And these are the sections that are addressed. Not all of them will apply to you, but they're addressed in that live performance document from the Ministry of Labour, which is linked below. And then we look to controls. So we describe what controls mean. I have the pyramid, which shows you the effectiveness of different controls. And then we have individual descriptions about each of the types of controls. Okay, so for the most part, we were dealing with working at home was elimination. We did that for a very long time. Substitution is not an option with COVID. Engineering controls involves a lot of barriers and removing unnecessary doors and that kind of thing, physical things. And most of what we're doing at this point is administrative controls and some PPE. Okay. Then we have the beautiful Swiss cheese image for your enjoyment, and then a summary of the control measures just put into a chart form. So in this one, I do have the indoor patron capacities, which at present is for indoor seated performances, 50% of the usual seating capacity. And it's based on the fire code number. Okay. Different types of screening that are required, personal protective equipment and face coverings, lines, how to make sure people are going to be distanced and wearing masks in lines. We have seen a tremendous move forward with the barriers. So at this point, the only requirement, there are still barriers for things like ticket scanning and, you know, some of those kind of front of house activities. But when it comes to the concert hall, performers need to maintain a distance of 2 meters or more from spectators or be separated with a plexiglass or some other impermeable barrier. So that essentially is telling us we don't need to use barriers as long as we can keep the audience 2 meters away, which in most cases is very easily done. We do not have requirements for barriers between performers or any specific requirements for singers or players of brass and wind instruments. And this is just a summary about cleaning, reservations, posting of capacity limits, tents, and canopies, and the fact that there is nothing in the reopening act about liquor service and sales anymore. And then we have just a quick identification of the requirements under the exit step. You can see that if we get to that step, we will only need to do passive screening, face coverings. There will be a requirement indoors, but with the same exclusions. And then we have an acknowledgement about this Resilient Ontario Orchestras project. So that's the first document. It's really very much a background document. And now I'm going to jump in and show you the actual plan. Okay. All right. So again, this is a template that you can customize for your organization, replacing all the highlighted information. There's a disclaimer to tell you when it was prepared. And it starts off with a very similar description of the other document, the purpose. It's good to identify who is going to lead the development and implementation of the plan. So ideally a title, it may be, you know, the board chair, or it may be, you know, the vice president or some other role. And also make sure that if there are tasks that need to be taken care of, that you do designate if someone's away from the organization for a period of time. Identify what employer refers to in your case, as well as supervisor. So a supervisor is any role that has charge of a workplace or authority over a worker. It could include that role of a pandemic safety monitor or COVID compliance officer, if you choose to have something like that. Workers and volunteers is orchestra members, independent contractors, volunteers, etc. And here we have the link to the Government of Ontario template. And I've used that template to create this template, which is more specialized. So as you know, we start off with a section about communications, and I encourage you to have someone, oops. Okay, this is when I find what I need to do to correct. So with this one, I need to just remove the Waterloo Public Health info and just identify that this will be, so you want to make sure someone is regularly checking the Government of Ontario website and also your local website as well for public health. Identify how you're going to communicate with orchestra members and volunteers. So email is pretty common. You may need to do some printed mail if you have people who don't have access to email. You may be doing a lot of Zoom meetings, virtual meetings, and provide them with some contact information in case they have questions. Next, identify where you're going to keep a copy of this plan. It could be that you will have one at your rehearsal space, your performance venue, maybe in all the documentation for your board, etc. You need to post a one-page summary of your plan, including instructions on how they can get access to the whole thing. And you may choose to put that on your website. You may choose to post that at your venue. This is just to identify it and say who's going to distribute it to your orchestra members. Okay. There will be changes. This has happened throughout, but when there are changes, identify who is going to review updates with the music director and review the relevant section of the plans and then send out updated information and plan revisions. Okay, you need to identify who's going to make sure people are trained, and someone should hold safety talks with the orchestra members to review the planned activities and potential for other hazards and corresponding precautions. So this can be, you know, a short conversation that happens at the beginning of a rehearsal, or you may choose to do a Zoom meeting where you review the whole thing, as long as everyone is well informed. You need to post notices that are required by your local public health or other government regulations. This will include the maximum occupancy for your venue. There are workplace posters available from the Government of Ontario, and you will also find those on your local public health website as well. Okay, and you're also encouraged to communicate with people resources that are available for financial, mental health, and other supports, and there is a link that will lead you to some of those. So that's the communication for your people, and then you also need to be communicating with your patrons. So you need to identify who's going to review this. You may communicate with them through your website, social media, your online booking system. You may have a voicemail message where you give updates as well. One option is to post the summary of the plan on the website, distribute information requirements to patrons through the online booking system. So if you use something like Eventbrite, you have the opportunity to email everyone with their ticket confirmation. And then several days prior to the event, send instructions such as, you know, what kind of screening will there be? Do they need to physical distance? Reminders about masks and face coverings. And this is really important that during the event, everyone is modeling compliant behavior and reminding patrons of requirements. So whether that's ushers or other front of house staff, that's important. So screening. So at the moment for orchestra members, volunteers, including anyone who's been vaccinated, there is a requirement to do a daily screening, and there is a free worker and employer screening survey available through the provincial government. And then you can identify who they can email their results to, have someone available to check that all of those screening emails have been received. And if anyone forgets to do it or can't access it, they can complete a printed version. So as long as, you know, if someone does not submit a past screening result, they cannot come into your site. Someone needs to be monitoring and retaining records for 30 days, and also retain records of attendance so that you know who attended the rehearsal. If you have to arrange for contact tracing, how can you make sure that you knew everyone who was there? Now, I find that this is a pretty good way to do the screening. If you have another option that you want to substitute, that's absolutely fine. This does give you an option. Screening for patrons at this point, passive screening is required. If you prefer, you can implement active screening. So I'll just give you a little description of passive screening. So everyone needs to have a reservation to attend, and you need to collect their contact information. A reservation to attend does not mean you can still sell tickets at the door. That's not a problem, but you do need to collect contact information. With passive screening, you post signs at all the entrances that give clear instructions, telling people how to screen themselves and instruct them if they have any symptoms or exposure not to enter. People are assumed to have screened themselves. You don't have to ask them. And if you hear someone saying, well, you know, I've got a bit of a fever, then you should ask them to, you know, not enter the building. So that's how passive screening works. For active screening, if you choose that, there is a comparable online screening survey, customer screening through the provincial government. And you can use that in the same way that we use the worker one for orchestra members. Temperature screening is not required. I know it was a big deal early in the pandemic, but it has not been found to be especially useful. So as you look at this template, there are a bunch of things in red which relate to the exit step. You can delete those. You may want to delete those for now, but save the original template in case you want to make a change. And then the really important part of all of this is preventing transmission. So there's a little introductory piece. There's a reference to the live performance guideline. And then we go through the different things that you can do. So hand and respiratory hygiene. You may want to confirm with your venue, like I would expect they're going to provide soap and paper towels. Are they also going to provide hand sanitizer? Perhaps, perhaps not. They may want you to bring that. Physical distancing. So when it comes to orchestra members and volunteers, make best efforts to maintain 2 meters distance, including on stage, backstage during rehearsal and performance. When distancing is not possible, there's a couple of options. People should stop, it should be their supervisor, and talk about how to either adapt the task or use personal protective equipment. So when you're doing your setup and load in, if you have things that need to be carried by 2 people, you can consider a buddy system so that whoever's carrying stuff isn't being exposed to a great number of people. They can reduce the number of close interactions. This is just to confirm that orchestra members need to maintain a distance of 2 meters from patrons, and only essential orchestra members and production crew will be allowed backstage and on stage, no visitors and no meet and greets. So we're trying to reduce those contacts. When it comes to physical distancing for patrons, there are posters through the public health that can be posted at entrances. Exit step, physical distancing will not be required. And here's the one that I think you're really going to have to look at and see how it will work for you. So these are specific music precautions. Singing and playing wind and brass instruments are considered higher risk. And this is a paragraph that's taken out of the live performance document. So we don't have, final peer-reviewed information, but we do know that those are activities that raise concerns. So here are some things that you can do with your orchestra, just in a general way. Ideally, have people arrive appropriately dressed so they don't need to use a lot of dressing room or washrooms. But if that's needed, try to find other unused spaces that you can spread people out more. During breaks, you may ask to use front of house washrooms just to make sure there's less crowding in the backstage areas. When you're placing chairs and stands, spike them for distancing, while allowing for reasonable adjustments for sight lines. Everyone needs to be able to see properly. Each person should have their own parts and music stands wherever possible. This may mean that percussion assignments need to be reevaluated to minimize sharing. Once music is distributed, each person should be responsible for their own parts. Masking remains the best way of reducing potential infected aerosol from circulating. So we will look at that a little bit separately. And this is through the discussions that we had with the 2 orchestras I worked with. We came to the idea that rehearsals should be limited to 2 hours, including a 15 to 20 minute break. In spaces with good ventilation rates and HEPA filtration, increased times may be considered. So that will be a discussion for you to have within your orchestra. To help with cleaning, make sure all personal items are removed at the end of each call. And this is some information really about dealing with instruments. So don't leave cases in common areas. Bring instruments on stage in cases and keep your case under your seat or beside you. If there's a large instrument case, then they should have a designated area, which is restricted to the owners of those instruments. Individuals are responsible for bringing, removing, cleaning, and disinfecting, as applicable, their own music stands, instrument stands, reed trays, backrests, accessories, etc. Confirm if you will ask people to bring their own music stands. Again, that's something that you may choose to do or you may not choose to do. Clean chairs should be provided by the venue, and percussionists should not share mallets. Then we've got some specific info for wind and brass, encouraging you to use large, well-ventilated spaces, reminding you that yes, the use of wind and brass instruments is permitted indoor and outdoors. I know there was a lot of discussion about that certainly a year ago. Masking still remains the best way to reduce aerosol infections. You may want to consider slitted masks for some of your wind and brass players, but that's an optional choice. Individual plastic windscreens are recommended for flute players. And we can ask, I think it was John who was cluing us in. John will perhaps tell you a little bit more about how those were fabricated. Based on an assessment of the orchestra layout, plexiglass or some other impermeable barrier may be considered. It's not required, but you know, the comfort level of your players may identify some people who will prefer that. And so you need to consider that option. Bell covers may be considered for brass players. When it comes to wind and brass, they should be provided with disposable absorbent pads, such as puppy pads, to catch and contain condensation. Nobody should be emptying instrument condensation on a bare floor surface, and that individual must remove and dispose of those pads when they're done. These are a few suggestions for dispersing droplets, emptying moisture from the instrument, cleaning out the instrument with feathers or swabs, blowing into the tone holes or spit valves to clear out moisture, blowing into the mouthpiece when removed to clear out moisture, and releasing air from the sides of the mouth. Section 4.4 is about preventing crowding and gatherings. So really all you need to be doing is posting maximum occupancy limit posters at each of your entrances. And then if there is an emergency evacuation, make sure that physical distancing is maintained when people arrive at the muster point. So if the building is on fire, you will evacuate. Don't worry about keeping 2 meters apart. Get out of the building, get to your muster point, and then space out. Physical distancings and masks or face coverings in lines. When you have lines, you know, entrance to the venue, beverage sales and washrooms, figure out a way to maintain those 2 meters of distancing. It may be with stanchions, it may be with markings on the floor. People are pretty used to that, but I've noticed people have gotten very poor at actually remembering how far 2 meters is. So if everyone wants to take a minute, stretch your arms out from side to side. The distance between your farthest fingertip and the other is going to be roughly equal to your height. So I'm a little bit shorter than 6 feet, obviously. I'm 5'4". So I need to think about that as being a little bit further than my wingspan is how far apart I should be if I'm lining up. And everyone who's in line needs to wear their mask or face covering. I know I'm talking, this is like the fire hose of information. I seem to be prone to that, but we are making good progress. Face coverings and PPE, everyone needs to wear a face mask or face covering unless entitled to an exception as noted in the regulation. And we all know that those exceptions include things like physical disabilities, medical conditions, 2 years of age and under, and there's quite a long list of exceptions. Orchestra members are not required to wear a mask or face covering when rehearsing or performing. However, those who can perform with a mask on should do so. So this will be another point of discussion that you want to have with your orchestra members to identify, is everyone going to go mask free? Is everyone going to mask up? There are some specialized slitted masks for wind and brass players, which you may find it's valuable to adopt. Regardless, each person needs to put on masks or face coverings at the beginning of each break or intermission and at the end of each call or service. So removing your mask to perform or rehearse is for just that. It's not for arriving. It's not for unpacking your instrument. It's not for, moving about the space. You should be masked during all those other activities. And I recommend that there be some extra masks made available. So have some disposable ones on hand. You may need to look at circumstances where there is not going to be 2 meters of distance, not going to be separation by a barrier, where you may need to go into full personal protective equipment. I think this is likely to be fairly rare, but it may be, when you're doing ticketing, it may be selling food and beverage, or if there's hair and makeup to be done. So likely to be fairly rare. And make sure that you've got some plastic lined garbage bins near the exit for people to toss out their disposable masks. For patrons, again, they need to be masked. They can remove their masks for consuming food and drink. You should have ushers to remind them, and onward. Cleaning and disinfecting, we've learned a lot about that in the course of the pandemic. At this point, Ontario requires cleaning and disinfecting as frequently as necessary to maintain a sanitary condition. There are some links to Public Health Ontario and products. Confirm with the venue who is going to be doing that cleaning. Typically they will, but if they're expecting you to do some of the cleaning, then you should be aware of that in advance. A little bit of information about cleaning things like point of sale terminals, minimizing high touch shared surfaces. So provide some areas for people to put their personal belongings. Wherever possible, make sure things are not shared, and plan so that you can minimize shared surfaces. And when it comes to cleaning, there's certain things that need to have extreme care. They need to be cleaned in accordance with manufacturer's instructions. And this includes instruments, control equipment, including audio and lighting, and things like microphones, headsets, and radios. You should all be responsible for cleaning and disinfecting your own personal gear, and anything that's shared should be cleaned before and after each use. And then we've got just a repetition here about the absorbent pads for wind and brass. If there is a suspected case or an exposure, there may be additional instructions about deep cleaning from public health. Now we move on to ventilation and airflow. Outdoors is ideal, but we're heading into the fall and winter, so we're more likely to be indoors. And this is some info about what to look for in terms of your HVAC, your heating, ventilation, air conditioning systems, that they should be clean and in good working condition. Increase air exchange settings if at all possible. Use the highest efficiency filters that are compatible. Keep areas near inlets and outlets clear, avoid blocking them with furniture, and avoid recirculating air. When you're looking to breaks, ideally people will pop outdoors, take a little break from wearing their mask. But if it's indoors, make sure that you have space for people to be distanced. Try to schedule your breaks so areas are not crowded. Spread out chairs and tables. Suggest that people bring their own filled water bottles. If you're going to offer beverages, snacks, and meals, then make sure there are individual servings with no shared food or serving items. And people should take home all their containers and dispose of their food waste appropriately. So what do you do if you have a potential case or suspected exposure? This just walks you through the expectations from public health. You should identify an area where someone could self-isolate if they begin to experience symptoms. If someone calls in sick, then make sure that they do the self-assessment. If they show symptoms on site, if someone's very ill, call 911. Let the operator know there may be someone with COVID-19. Otherwise, direct the person to return home and isolate immediately. If they can't leave, and I'm just going to make a revision. So this is page 12.
And Janet, just a quick time check. We're at 12:56 right now.
Okay, so I'm meant to be going on to discussion very soon, right? Or am I way past?
Just in the next couple minutes, if you're able to.
Okay, I'll wrap her up. Okay, and then there's the information about who you contact and how you follow up, and very similar for a suspected case. Management of new hazards is looking at what are some of the things that may have changed because we're taking precautions for COVID-19. So think about how you can deal with any challenges about physical distancing during a variety of settings, and also think about the mental health impacts from the ongoing changes due to the pandemic. Okay. Hazard management, you're going to be relying on the protocols you've established to mitigate these hazards. When it comes to plan monitoring and evaluation, you should do your best to gather feedback through regular conversation and daily safety talks to confirm everything is working out and identify issues. Encourage patrons to share feedback through, perhaps through your website or some kind of a survey. You should have someone to conduct a walkthrough of your venue just to make sure everything's all good, and then respond promptly to any issues that have come up and take corrective action. And then the final page is just, this is what your snapshot will look like. You'll tell people where to find the whole plan, and then you'll put a few points down under each of these. So, and then we have the acknowledgements for Ontario Trillium Foundation. So I know that's an awful lot. Thank you all for being so patient and listening to it. And then finally, we're going to get to talk to our guests from our orchestra. I know you had to listen to me for a very long time. Here we go. Okay, so I'm going to ask some questions, and I'm very, I guess we better introduce you guys first of all. So first of all, I'd like to introduce John, if you can tell us a little bit about yourself and go for it.
Thank you, Janet. My name is John Kraus, and I respectfully acknowledge that I'm also speaking from Peterborough, which is the traditional territory of the Mississauga and Anishinaabe. I am happy to be the music director for the Northumberland Orchestra and Choir, which is located in the metropolis of Cobourg, just east of the GTA and Durham region.
And let's go to Marie now.
Hello,
Marie.
I'm Marie Narini, and I'm with the Northumberland Orchestra and Choir. I'm in Newcastle, where I live, and it's the traditional lands of the Mississauga and the Haudenosaunee Indians. I think we're under the Williams Territory Agreement. And I'm quite happy to be here. I'm a bass player, and I'm on the board of directors as vice president.
Thank you, Marie. And let's go to Daniel. Daniel, tell us about yourself. It's okay. It's okay. I can see the unmuting in progress.
My name is Daniel Warren. I'm the music director of the Kitchener-Waterloo Community Orchestra, and I want to acknowledge that the land on which the KWCO rehearses and performs are the lands traditionally used by the Haudenosaunee, Anishinaabe, and the Neutral people.
Excellent.
Great.
Thank you, Daniel. Thank you, Marie, and thank you, John. So I want to start with a question. Just when we began this process of creating this plan, we needed to sort of lay some groundwork and understand about how each of the orchestras operate. And we needed to figure out how we were going to work together. So I'm going to go to Daniel first, and I'm going to ask Daniel, can you tell us just a little bit about your orchestra's setup? Where what's the venue where you rehearse and perform? Tell us a little bit about your players and how you guys make decisions.
Sure. Yeah. So we have a board of directors. Everyone is volunteer except for myself, and we do have some paid positions in the orchestra for its principal strings. We rehearse in a place called the Adult Rec Center, which is a fairly old building. Actually, it's in the process of being demolished, I believe, which you see me crying.
Yeah.
But we do perform at a local church, which is very new. It's a beautiful building, beautiful acoustic. Yeah, a lot of our players are, I would say, a little older, so there's some real concerns about health issues. There's although surprisingly, many of the people we have talked with, they're gung-ho to get back to rehearsing, but at this point the city will not let us into our venue to rehearse just because it's not, I think you can get 10 people in there and they're just not allowing it. So
right.
Yeah, it's
So
actually interesting that the differences between our two organizations are quite dramatic. It's actually was really good the way this worked out, that we were able to come to both ends of the spectrum as far as what our requirements were and how we operated. So
yeah, I agree. It was a very productive conversation. I'm going to go to John now. Can you tell us a little bit about Northumberland?
Sure. So we, we're unique in the sense that we've both got a choir and an orchestra, but I will focus specifically on making music as opposed to designating a difference between them. We have a very, very wide range of ages, where some of our orchestra members are in their mid to late 20s. And then we've got some who are of a much more senior vintage, we'll say. The venue that we make use of is a United Church, Trinity United Church in Coburg, primarily for, well, it is for both rehearsals and performances. The biggest challenge that we faced was waiting for an opening, waiting for a startup opportunity. And we were pressed for time of sorts because of an administrative process that we were in process of selecting a new choral director. And with a lot of work and a lot of innovation, our board was able to make it possible that we actually held 3 auditions with live singers, physically distanced. I didn't want to say spaced out, physically distanced from each other in the sanctuary, masked. And we were very fortunate to have our candidates come forward and participate with a reduced number of singers, but it was a very, very productive and fruitful opportunity for us to make music for the first time in a long time.
Now, Marie, I know you got to attend some of that. Just give us a glimpse. What was it like?
It was awesome. Everybody complied with all our protocols, masks and distancing, and just to hear the voices all together with a piano, it was just like I had goosebumps.
And those are the very best kind of goosebumps.
Yes.
So, we had some similarities. What were, I'm going to come back to Daniel. So what were the things that you felt were kind of similar and different between your orchestra and Northumberland?
Yeah, everybody wants to make music. There's a similarity, everybody's gung-ho. People, through this pandemic, people have been going out to get food. They've been doing the things that they need to do. And music doesn't always get put in that category of something that we need to do, even though it's extremely important for well-being and mental health and just general good feelings. But so that was definitely something common. The fact we don't generally, I'm not sure, we've done a couple of times, we've worked with a choir. So that's something completely different. So there's a whole set of protocols surrounding vocal choirs and things that we don't have to deal with.
And Daniel, can I just interrupt and ask you to tell us a little bit about the the Waterloo region they had some, they were delayed from moving into step 3. So has that put you in a slightly different place in terms of how cautious people are feeling just because of the regional caseload?
I kind of don't think so. I mean, maybe you might ask somebody else and they might say something different. I don't sense that.
Okay.
You know,
It's just one of those factors that you have to roll with.
Yeah, I mean, it seems to be sort of leveling out now. And actually, I don't live in Kitchener, I live in Guelph, and I think Guelph has the highest per capita vaccinations, complete vaccinations of almost any city in the world right now.
Wow.
So it's amazing. Yeah. So, and
congratulations.
I'm not sure. Yeah, it's exciting. So I'm not sure if that goes over into Waterloo. I think the Waterloo region is also in a pretty good space, but.
Do you have anything, John, to add to these sort of similarities and differences? I know we've spoken about the choir.
With similarity, I think in the broad spectrum, our demographic for performers is very similar. Our demographic in terms of what people do for their livings and whatnot is similar. So as a result, there are there's a lot of similarities, I think, in just who it is that we are working with and who it is that we would be working for in terms of our patrons as well. Differences, the local health unit that we belong to is a much, it's a smaller population, but it's a much larger geographic location. And as a result of the smaller population, I know that the numbers that are specific to the Northumberland County area, which is where we're focused in, is much smaller. Having a daughter who lives in the KW region where Daniel's working. So I think that may have had a slight impact in terms of the comfort for our singers to come forward. But I also think it had something to do with the zeal of just getting back to sing and perform. So,
yeah,
and
go ahead.
Go ahead.
I'm going to move over to Marie now because so Northumberland has had the opportunity to get started and do some choral work. Can you tell us a little bit about what was it like to implement that? Like what kinds of things did we've sort of looked generally at the template, but what were the kinds of things that your singers and your auditioning choral directors had to think about? Like maybe just one or two that
Well, I was in charge. I volunteered to be in charge of checking people in. And also we had a protocol. We used your template and, like you said, downsized our protocol requirements to the church, and the church agreed and we followed their protocol. And what we did was we had almost a pre-register. You could register at the door. And we asked that they were pre-screened online. If not, I had paper copies of the pre-screening. And also we were adamant, and our membership was adamant that people attending had the 2 vaccinations. So that was a question we asked. We didn't ask for proof, but that was a question. We have that recorded and who actually was there. So
Okay. And you mentioned that your venue was well satisfied with the information that you submitted. Yeah, that's good. That's really good. Nice to have everyone all in the same place. And Daniel, looking at KWCO, at this point, you're somewhat in a holding pattern. You were going to do some communication with your orchestra members and discussions are continuing. Can you tell us a little bit the challenges of that?
Yeah, so we did send out just this past week, we sent out an email to the page or to the performers, the orchestra members, letting them know what we'd been through here with Orchestras Canada and you, Janet, which has been great. And that we're definitely, things are in the planning stages, but at this point, just because the city will not let us in to rehearse in our regular venue, we've had to say that we're canceling rehearsals for the fall. So, I mean, I suppose if we had found somewhere we could have rehearsed outside or whatever, I was talking to somebody yesterday, Chris Sharp, I see he's here from Stratford. I know I was talking to somebody in Stratford Symphony yesterday who they were prepared to rehearse outside, and the city shut them down on a sound ordinance after 7 o'clock. They said it was going to be too loud. So you wouldn't have been able to hear the motorcycles and the hot rods for the symphony orchestra practicing in the church parking lot.
Oh no.
So anyway, yeah. So, so at every turn, there are things that you come up against. So for us, there's just nowhere for us to rehearse at this point. And there's some people on our board that are quite hesitant about getting back. From a legal point of view, there's some concern if somebody gets sick that there may be some liabilities, and so. But I have to say that these protocols and the sheets, the fact sheets, and the safety sheets that are together are so helpful. And I'm sure Marie and John, when you presented that to the church and you said, "Well, this is what we're working from," it was probably extremely helpful for them to be able to see, oh, look, there's been quite a bit of work done here. You're prepared. You understand what the risks are. You understand what kind of things you need to do to make sure that they're also covered. So I'm sure that was really helpful.
Very much so. And further to that, about an hour ago, I'd just gotten off a call with the church and our executive committee, and we presented even more information and some further questions on our behalf as well too, in looking ahead to say we're hoping to start physical rehearsals. I think the biggest landmark that all of us are waiting for is we've had the announcement about the announcement of the announcement that's coming for September 22nd. So once we get that passport, whatever the heck it's going to be, in place. And that's just another hoop that is going to allow us to say, yeah, we've checked that mark off of our list. And we are now working with and communicating and congregating with a group of people that are following yet another level of government security, I'll say, with the question mark, getting us even closer, we hope, to that next stage, whatever that might be, when we can bring everybody together under one roof.
Sorry, John, you're speaking of double vaccination?
Well, yeah, it is the double vaccination certificate that the government of Ontario is requesting of people to get into public spaces, and there's a whole list of at any rate, that's coming. September 22nd, I believe it is.
We passed a motion in our board as well to require double vaccination for rehearsals and concerts of the membership as well. So we have an AGM coming up on the 23rd, the day after the announcement of the announcement, and that is something that our board has been considering, and we will be bringing to our membership.
Excellent. Now, I know that there have been many, many challenges in this past year and a half. We have all seen the ups and the downs, the excitement about getting back, being delayed, being changed. But I know that in my life, I've been very lucky to experience some silver linings to and really trying to appreciate those, as so much has been taken away. I'm going to start with Marie and ask you just to think, like, can you give us something that was maybe unexpected, or just a moment that sort of raised your spirits in the midst of all this?
Well, I had time. I was so busy with music and music groups that I had really time to just sort of exhale and say, and I was a home cooked meals anyway. So getting your weekly groceries or something like that, it was a planned trip. And at one point, I almost became agoraphobic, but through a little longer, I really appreciate both alone time and out in with groups of people and talking to them. And I think I've become more understanding too about people's situation and where they're coming from. That's all.
Yeah, it has been a time of reflection for a lot of us.
Yes.
Daniel, what resonates for you around silver linings?
Yeah, so we set up a Facebook page for the members. Probably a lot of the groups have done that. So there was a private Facebook page, and people posted memories of past concerts. There were some MP3s, there were YouTubes of various things that really kept us thinking as a group together. It was great. Some really beautiful nostalgic moments. Our orchestra has gone on several tours. Actually, we've been to Prague, we've been to Austria, we've been to Great Britain, we've been to the Netherlands. We had a trip planned to go to Italy last fall, not this just past fall, but the fall before, when the pandemic broke out. So there's lots of, pictures of the trips and things like that. There's one little thing that I feel, a point that I made just recently with the group. It seemed to me there was some real hesitancy to get back to rehearsing from some people, and I couldn't quite put my finger on it. It didn't seem to me to be didn't seem to make sense. So I made sure that all of the orchestra members knew that if they were not prepared to come back to play early, that their seat would be held until such time as we said, okay, this pandemic is over, to the point where we're going to get together and rehearse. And there was maybe a little collective sigh of relief that people felt that, if the orchestra got back together and started to rehearse, and there were some people who didn't feel comfortable, well, you're done. So we'll get a new player in and you're replaced and you're gone. So we made sure that was really something that was very clear as far as our community of players and our family of musicians. So,
and that sounds like that reassurance would again allow people to exhale a little bit, because when music is so central to your identity and how you want to live your life, I think the potential loss of that would be really devastating. So I think that's a really important step to give that reassurance. John, where do you sit on the silver linings list?
Well, the silver linings, it's interesting because one of the things that came up was within our organization, how do we keep in touch with our crew? And our board, over the period of 18 or 16 or 17 months, whatever it was, has actually had over 50 plus meetings planning and working and discussing how we can best serve our membership, as well as what can we do. So one of the things that was proposed directly to me, and I won't say who did it, but there was an opening at our local radio station. It's a community-based radio station. And I'm now the host of a weekly music program that provides performances based on local ensembles and local groups, as well as some traditional, I guess we'll say, corporate purchases that you can download or buy at the record store, if you still do that anymore. The other thing that came about, and I got I got a great deal of help from one of my daughters in Ottawa, Vanessa, who's a member of the Parkdale Community Orchestra, and I know that there are a couple of folks online here, but she is a master at trivia, and she assisted in putting together a couple of trivia nights that I hosted with members from the NOC. And each time we just got together and laughed about silly questions that I was able to come up with, or that Vanessa was able to come up with, that stumped people or got them scratching their heads, and having a glass of wine or a pop in the background, and just doing something to try and relieve the tedium and the boredom and the isolation of being away from all of the people that we normally get together with in a week. So a couple of silver linings. Thank you.
I think those are fantastic silver linings. And I know that this time has certainly made me treasure those experiences that I might have taken for granted. A lot of the work I do is in theater, and I'm very lucky. I get a lot of comps to performances, and I see as many shows as I can. I attend as many concerts as I can, and missing that, there's something actually when you go back the next, I've seen some small cabarets and things like that. And, the first one I went to in July, I just cried. I just cried into my mask just because I was so glad to be there. I'm sure the people on stage must have thought I'd lost my mind because they were very cheery songs, a lot of them. But the experience is something that you go, no, this is different. Live is different. And I've also gotten to meet a whole pile of great people who I never would have encountered before. So that's definitely a silver lining. So we've talked a little bit about people returning. John, you were making plans to do some rehearsal. You're hopeful for this fall, right?
We are, yeah.
Performance-wise, when do you see a performance in the headlights?
Well, I'm pie in the sky guy here, and we've got plans for a Christmas program. We're very fortunate. The venue that we make use of has fully decked itself out with digital streaming opportunities. Because it is a church, they are now have been recording Sunday services, and are in the process of finishing up the final details to be able to live stream their services as well. And we, right from the beginning, when I came on board a few years ago, we fostered a relationship to become part of the community directly. And as a result of that, we have been extended the invitation to make use of those, obviously for a fee. But we will hopefully be able to gather a group of musicians and be able to stream something as a seasonal program, given the opportunities and wherever it is that we happen to be at when that time comes along.
Cool. And Daniel, you're at this point waiting to be able to have access to a rehearsal space. So
yeah,
probably a little bit less firm in terms of planning.
Yeah, we are motivated. We have in the new year, we have a concert that's planned. Every other year we do a Viennese gala with singers and full dinner, and it's cabaret seating and everything. So we've done that, I think, for the last 15 years or so. And this year we've put a sizable deposit down at one of the local halls where you can do these things. So we're really hoping that we're not going to lose this deposit. They've been very gracious in holding it on for a certain amount of time. But if we lose this spot, then that money, it's just money down the drain. So we're hoping,
I'm crossing my fingers for you.
Hoping, yeah. So hopefully we'll hear a little bit of opera in the KW region with us in February, March. So,
well, you're just up the road from me. So if you do it, I'll be there.
Okay, good.
So Marie, one of the challenges that many organizations have been facing as they go through this and try and make decisions is, how do you deal with differences of opinion? I don't know if you have maybe experienced any of that, or if you've had thoughts about that, but what would you say what's a really useful piece of advice that you would give to people who may have a group of orchestra members who have different perspectives? How would you suggest they might do well to wrestle that?
Well, at the start of the pandemic, I was involved in a youth orchestra, and I disagreed with the mainstream. It was a majority vote about the progress, how they were going to proceed. And I really disagreed with it, so I had to leave. But the NOC, I must say, they are the most, we bring up issues and we discuss them through, and we are the most amicable group of people. We work hard. Each of us works hard, and just try and see the other person's and see if you can make a workaround. What you had said about creativity and
problem solving.
Problem solving are your superpowers. Yes, that is definitely. And just try and find out where the other person is coming from, why they have they're not willing to go along or something. Just say, well, you know, we will try to work it in, that kind of thing.
Yeah, that's really helpful. And I think that's helpful for all of us to remember. I'm going to go back to, and I see the clock ticking away. John, how are you communicating to the public about the health and safety members you have information? Are you at that point yet, or is this maybe premature?
It's a little bit premature for us, and I'm actually going to backtrack just a little bit to further what Marie said. The whole idea that every member has an opportunity to speak and be heard, and it doesn't matter what position they're coming from or which side of the fence that they're coming from. We have made great strides in an effort to be sure that individuals have a chance to be heard and will be heard when we get together for our AGM. It's probably going to be at that point in a week and a half, I guess it is. No, not that. It's just over a week. Yeah, just a week from now that we will have our AGM, and then we'll be at the position, a better position to be able to communicate to the public at large. At the same time we say that, though, as Daniel alluded to, we do have a Facebook page which has a lot more people on it than just our membership. So cool. Any patrons and any community members who are interested in following what it is that we do, we have done our best to do to keep that up to date, as well as communicating directly through email to the list of patrons and members that we have as well.
Cool. And Daniel, I'm going to take the last question to you. I know, terrifying. We got to leave 4 minutes for the assembled masses to get in. So, do you have any questions that you're still pondering that you and there may not be answers to them, but who would you really love to know right in this minute?
Whether or not, if we get together and rehearse, if anybody's going to get sick.
Okay. So that's exactly what everybody's wondering.
Yeah.
Yeah. So that, I think, expresses what we're all trying to make sure doesn't happen, right?
Yeah. Okay. I don't think there's any, I just before we break and before we go, I just want to thank you, Janet, and Orchestras Canada for putting this all together. And those of you that are listening, these sheets that we got were given to us, and we took them and we worked them and put them together so that it worked for each individual group, changing this, and even in consultation and Zoom meetings as well. I wasn't at all of them, but we were able to come up with this great document that was really tailored to each individual organization. And you'll be able to do exactly the same. Some things won't apply to you, other things might, but it's just been great in every way. So
well, that's so great to hear. And I have so enjoyed working with the three of you and your teams. And I hope that we'll continue to cross paths, because I'd love that. I'm going to throw it back to Lauren. I know I've taken more time than I was supposed to, but I don't know whether we have a hard end or whether there's time for more questions. I leave that up to you.
So I think we've had about 4 or 5 questions come in through the chat. Maybe do one right now, and then for the rest, we'll try to get written responses to the folks who've asked them. So we'll just do one live right now, and then we'll follow up with some written responses.
Great.
So the first question, and I'm sure this is on a lot of folks' mind. So you've mentioned both orchestras that you're going with some kind of double vaccination policy. Someone has asked, for those volunteers or workers who are participating and are not vaccinated, is it required to have rapid testing or some other accommodation?
So I'll jump in.
Go.
The discussion that's happening with the NOC is hard. I believe, and this is my perspective and understanding, it's hard and fast. Double vaccination or full vaccination, with the caveat that if there is a medical preclusion or something that prevents, then obviously that individual has got circumstances beyond our control, beyond their control. We are still anticipating that when we come together, if we come together in groups, it will be fully masked and physically distanced. So we are trying to accommodate and work towards the best situation for all of the people that we can accommodate.
Yeah, and go ahead, Daniel.
Oh, just as far as, so we're as well, we're double vaxxed. We talked about rapid tests. They're 60% conclusive, so the worst thing would be to get a false positive and everything just go into an absolute tailspin. So we really are leaning towards the double vaccination. I mean, I don't know what'll happen with the tests, maybe not. But.
Yeah. And just a reminder that the provincial legislation refers to patrons only, and you do have the discretion about how you implement that with your orchestra members, your volunteers, and your workers. Most of the people who I'm dealing with in arts organizations are leaning very strongly towards a full vaccination requirement, with the exception of those people John described who have a medical exemption. Like a formal medical exemption from a medical professional.
It's very difficult to get medical exemption as well. There are extremely slim requirements for that. So
yes. Yeah. Catherine, would you like to jump in?
Sorry.
I put her on the spot. I saw her being spotlighted and I thought, oh, hello.
I think that what that means is that we have completed today's webinar, even if we've not responded to all the questions in the chat. Lauren has pulled the plug in deference to excellent use of people's time. We will be following up again with sharing the resources that have been developed, with a few of the corrections that Janet has noted in her summary. I'd like to start by thanking our orchestral colleagues, Dan from the Kitchener-Waterloo Community Orchestra, John and Marie from the Northumberland Orchestra and Choir, and of course to health and safety expert Janet Sellery, who seems to be able to command startling level of detail with both humanity and clarity, and I'm so grateful to you for that, Janet, and for the orchestra's enthusiastic participation. Folks, we know that the pandemic is not yet over, and we will be keeping you apprised of changes and developments as things roll along, but we think that this is a suitable update to last year's season opening sessions on health and safety during the time of COVID, and we look forward to continued sessions and continued contact on this challenging but not something that is not proven to be fatal to our industry. Quite the contrary, we come together, we learn, we implement, and we create safe places for people to make music and to enjoy music. So until the next time, gratitude to the Ontario Trillium Foundation, and I look forward to seeing you all soon. Thanks, everyone.
Thank you.